All right, welcome back. Let's just jump right into our next set of terms, shall we? Okay, first up, we're going to talk about the engine of the body, the heart. Really understanding these terms is absolutely fundamental if you want to get a grasp on how we discuss cardiovascular health. So let's kick things off with the word cardiac. It's pretty straightforward when you break it down. You've got the root, cardi, which means heart, and then the suffix ac, which just means pertaining to. See? Simple enough, right? So basically, whenever you see cardiac, just think of it as a label for anything to do with the heart. It could be a condition, like cardiac arrest, or a structure like the cardiac muscle, or even a procedure like cardiac surgery. It's a really foundational term for this whole system. Okay, let's build on that. Our next term is cardiology. And look, there's that familiar root again, cardi slash O for heart. But this time it's paired up with the suffix "lology." And if you remember, that means the study of. And just like that, you see how we go from a general descriptor to a whole field of medical study. Cardiology is that specialty, right? It's where a cardiologist diagnoses and treats heart conditions, using everything from the simple stethoscope all the way to those complex EKG readings. All right, let's switch gears and move on to the body's command center, the brain and the nervous system. You're about to see how this same word building widget just keeps on going. Our first term in this section is cephalic. The root here is cephal, which means head, and its suffix ic just means relating to. So you put them together, and what do you get? Something that relates to the head. Easy. Now, this is a really key directional term. When you see something in a medical text that refers to the cephalic region, it's talking specifically about the location of the head itself. Just think of it like a big, broad anatomical landmark. Okay, so from broad, let's get a little more specific with the term cerebral. The root cereber refers to the cerebrum, which, as you know, is the largest part of the brain, and that suffix al, well, that's just another one that means involving or related to. You see the precision here, right? We've gone from the entire head, that cephalic region, and zoomed right into a specific part inside it. So, cerebral is all about the functions, conditions, or structures of the cerebrum itself. Much more specific. Now, let's see what happens when we combine a few of these concepts. This gives us a really critical term, cerebrovascular accident. Let's break this one down. We've got cerebro for cerebrum, vascule for blood vessel, and that suffix R, which again means relating to. So the term itself literally tells you exactly what's happening. It's an event that involves the blood vessels of the cerebrum. Now, you probably know this better as a stroke. This accident is basically an interruption of the blood supply, either from a blockage or a rupture, and that's what can damage brain tissue. This is just a perfect example of how knowing these little word parts can help you unlock the meaning of a really complex diagnosis. Okay, let's shift gears one more time. Now, we're going to look at some important terms that have to do with how we actually diagnose and identify diseases. First up, we have biopsy, which is a super fundamental diagnostic procedure. The root bio slash o means life, and the suffix opsy means to view. So when you put it together, the literal meaning is actually pretty powerful: to view life. I mean, that's what a biopsy is, right? It's taking a small sample of living tissue from a patient, and then that sample gets examined under a microscope to figure out a diagnosis. Next up is a term for a very specific and very serious type of disease: carcinoma. The root, carcin, means cancer, and that suffix, oma, means a tumor or a mass. And this term is incredibly precise. It doesn't just mean any cancer. That oma suffix tells you it's a tumor, a mass. And more specifically, it's a malignant tumor that comes from epithelial cells, the cells that line our organs and our skin. All right, our final term for today is a piece of medical equipment: the cystoscope. The root, cyst slash o, refers to the urinary bladder. And the suffix, scope, well, that just means an instrument used for viewing. And once again, the name perfectly describes what it does. It's an instrument, a scope, that's designed to view the inside of the urinary bladder, the cysto part. It's a really key tool for urologists so they can examine the bladder lining directly. Okay, you ready? Let's dive in and put all that new knowledge to the test with a quick challenge question. Take a look at the question on your screen. Read it carefully and really think back to the word parts we just covered. Choose the best option. Okay, go ahead and pause right here and make your choice. Awesome work today. Seriously. The real key to mastering this language is just practice. So keep reviewing those roots and suffixes. Make sure you subscribe so you can keep building your medical vocabulary with our next explainer. We'll see you then.